Exercise and diet alone often fail to treat people with extreme and excessive obesity, so many people consider surgical options. Well, Sandoval Regional Medical Center is now offering bariatric surgery, so is it right for you? Well, we'll find out right now, because with us from Sandoval Regional Medical Center are Jen Ogden, Bariatric Program Manager. Welcome to you.
Thank you.
And also happy to mention that Dr. Ryan Tyner, a bariatric surgeon, has joined us this morning as well. Thank you both so much for being here.
Thank you.
Well, we all want to feel good and we want to look good, and we want to know first and foremost, who is bariatric surgery for?
So in general, bariatric surgery or weight loss surgery is for patients who have a high body mass index, which is a marker for obesity. Oftentimes that's associated with a variety of medical problems that go along with it. Things like diabetes, high blood pressure, high cholesterol, sleep apnea, reflux disease, or even fatty liver.
And it can also be a genetic thing too, right?
There's a large component of obesity that is related to genetics. It's also related to diet, environmental exposures, and a lot of other multifactorial reasons.
So there's a lot of people watching right now that probably have a lot of those issues that you just mentioned. And so I really want to understand the weight loss surgeries that you offer.
So there are 3 weight loss surgeries that we at ABQ Health Partners associated with Sandoval Regional Medical Center offer.
Okay.
The first one is the laparoscopic adjustable gastric band, often referred to as the LAP band.
Yes.
That's a prosthetic device that sits at the top of the stomach that's inflatable or adjustable that allows you to decrease the amount that you eat by feeling full and satisfied. The next option is the laparoscopic vertical sleeve gastrectomy. That's an operation where we make your stomach a lot smaller so you feel full and satisfied with a small amount of food.
Okay.
The last option is the classic operation for weight loss surgery. That's the laparoscopic Roux-en-Y gastric bypass.
Yes.
And that's an operation, that's an operation where we both make your stomach smaller to make you full and satisfied with small meals, but also bypass a segment of your intestines to really make dramatic and frankly miraculous changes in things like diabetes, high blood pressure, high cholesterol.
Yeah, and it's interesting because we see so many public figures that are success stories with that surgery, with all of them really. And what's really interesting is that, you know, it's not just about looking better. It is changing your health, and it really is so important for your future as well. So I want to know, for those who are considering these things, what are the general conditions that have to be met for these individuals to even qualify for bariatric surgery?
So the first and most important thing is being overweight.
Right.
The way that's described by multiple different entities is that you need to have what's called a body mass index, which is often referred to as a BMI, which is a ratio between your height and your weight, which sort of standardizes things for a variety of different patients. And that body mass index has to be greater or equal to 40, which is how we define morbid obesity. And morbid obesity just means that your obesity is affecting your health. Now, you can also have the surgery performed if your body mass index is between 35 and 40, as long as you have some of those serious weight-related medical problems like the diabetes, sleep apnea, and those sorts of illnesses.
Okay, so now, and I know the question on everybody's mind, how quickly do they actually see the results?
So they will see these results right away.
Really?
So let's take, for example, the laparoscopic gastric bypass. So lots of times we see these patients who have diabetes, for example. Maybe they take a bunch of medications, maybe they just use some insulin at home. They'll come into the hospital, have an 1.5 to 2 hour operation, and during their 2-day stay in the hospital afterwards, we will oftentimes see complete resolution of their diabetes. And they will leave the hospital on no more medications, no more insulin, with normal blood sugars in a large number of cases.
That's incredible. And of course, we're talking about all the plus side. I have to know also, are there any risks to bariatric surgery?
There absolutely are, and this is a big decision for patients to make. It's a big decision in terms of their lifestyle afterwards. You need to be committed to living what I describe as a lifestyle of moderation, meaning small portions of food, smart decisions about what you're taking in, but also, in addition to that, there are surgical risks that can happen. We see somewhere between a 1% to 2% serious morbidity rate, which means a serious problem related to the surgery. And although we do these all laparoscopically with 5 very small incisions in the upper abdomen, it is a very big surgery inside, and so it's something for patients to really think about, and it's something that we discuss as we meet them for the first time.
You'll give them a great consultation, you're there for them, and you can tell them exactly what direction they need to go in. And in fact, I'd like our viewers to know how they can do that. Where can the viewers go for more information?
So our viewers can visit our website at abqhealthpartners.com, or They can email us at bariatrics@abqhb.com or even call our office at 262-7281.
Perfect.
And we can go through exactly what their insurance benefits are, make sure
Great.
that they qualify, tell them their
Good.
body mass index if they're interested in finding it out,
So good to know.
and give them a nice introduction into the program.
Great. Well, great information. Thank you both so much for being here. Really, we appreciate it, and we hope a lot of people contact you. Thank you.
Our pleasure.